Baby fell from bed. Is it dangerous? Your 6-month-old baby fell from the bed, approximately 1 meter high, and has a bruised forehead. After the fall, your baby seems less lively, has weak sucking, and is not as stable. You have taken your baby to the hospital. This is a concerning situation and needs to be closely monitored. What to do next? Typically, doctors will advise families to continue monitoring the baby's condition and schedule regular follow-up appointments. What to do next? However, if you are still worried about your baby's condition, especially if you suspect a head injury, you should take your baby back to the hospital immediately. Doctors will assess the baby's clinical condition, check for any unusual signs, and make appropriate diagnoses. What to do next? In some cases, doctors may recommend imaging tests such as a CT or MRI scan of the brain for a more comprehensive evaluation. What to do next? The silent technology in the 3.0 Tesla magnetic resonance imaging MRI machine from GE Healthcare USA could be a suitable option for your baby. This technology is especially helpful for patients who are children, elderly, or have weak health, as it reduces noise, provides comfort, and minimizes stress for patients during the scan. Important notes: closely monitor your baby's condition after the fall. Check for any unusual signs like vomiting, difficulty breathing, lethargy, seizures, bleeding from the ears or nose, or bruising in other areas of the body. Important notes: do not give your baby any medicine without consulting a doctor. It is crucial to seek medical advice before administering any medication to your baby. Stay calm and reassure your baby. This will help your baby feel safe and secure. Important notes: in conclusion, a 6-month-old baby falling from the bed and getting a bruised forehead needs careful monitoring as it could affect the baby's health. It is recommended to take your baby to the hospital for examination by a doctor and appropriate treatment. Additional points to consider: head injuries in infants can be serious even if the fall was from a short distance. The baby's head is still developing and more vulnerable to injury. Look for other signs of injury besides bruising. Be aware of any changes in your baby's behavior, feeding habits, or sleep patterns. Additional points to consider: seek immediate medical attention for any worrisome signs. Do not hesitate to call an ambulance or go to the emergency room if your baby shows any signs of distress, such as difficulty breathing, loss of consciousness, or seizures. Additional points to consider: take preventive measures to prevent future falls. Consider installing safety gates, using a crib with a firm mattress, and keeping all sharp objects out of reach. Remember, it's always better to be safe than sorry. If you have any concerns about your baby's health, seek medical advice immediately.